Hey, doctor, two quick questions for you.
What's that, George?
Did Larry fix the headlights on your car, the problem you had?
Not yet. Okay. No, and the reason for that is that I was supposed to take my car to him this past Friday.
He mentioned that to me yesterday.
Yeah, well, no, I know, and I'm the guy that let everybody down. But Robin got held up in this snowstorm business with the flights, and I needed somebody to follow me in that car because I don't really trust myself to go anywhere in it without having let's say another vehicle nearby. So no, Larry hasn't had a shot at the caddy's eye lights. You know what I mean?
You must have oil and gas on your veins like I do.
Well, I was an automobile mechanic before I was a doc.
I got two bulging discs on my back and a slip, and I'm very overweight. And what do you think about surgery?
Well, I'll tell you, Larry would tell you not to do it. Okay. Yeah. Well, here's the deal about bulging discs. They're normal. Okay, so if you take a look at your car, especially those that that don't have these little teeny tiny 22-inch rim type tires, they bulge on a hot day. The sides of your tires should bulge. Okay, now in order to know whether or not there's enough pressure in there, you have to use a pressure gauge, but you don't use your eyesight to do it. A disc is supposed to bulge. If you really want to know whether it's normal or not, make sure that you get your MRIs done first thing in the morning before you've had a chance to stand up to make them bulge. That's not the same thing as a herniated disc. Now, how much space is there between the dura mater, that's the membrane surrounding the spinal cord and the nerves passing down, and the disc? And the answer is anywhere between 7 and 11 millimeters. That's a long way, so it takes a lot of bulge. In fact, it takes a lot of herniation to actually put any pressure on these nerves. So do I suggest anybody get surgery for bulging disc? And the answer is no. When I was at Duke, they were very, very clear in general surgery that you do not operate on a back for pain alone. So if it hurts, okay, there are things you can do. There are lots of things you can do, but surgery should not be one of them. Is that kind of, and what was the other part of that question, George?
The slip. Let's say I have a slip.
Well, there's no such thing as a slip disc.
Really?
No, it doesn't work that way. People say, oh, well, one vertebra is advanced on the other. It's something that you've had since you were a little kid. It's called spondylolisthesis. Does it make much of a difference? No. Okay, so do you want to go ahead and put a cage in your back? Probably not. Here's why. Statistics run like this. If you operate on a back for pain alone, there's a 2/3 likelihood that it'll either stay the same or get worse, and a 1/3 possibility that you'll see any improvement. And that doesn't mean pain go away. Those are lousy odds, George. Okay, really lousy. Now, I have a herniated disc in my lower back, left lower back. I can't feel my left foot. And I was not going to let anybody operate on my back. I'm now just about fully functional. Okay, yeah, I still can't feel my left foot, so I have to be careful what I do, but I'm not a statistic. And George, I would suggest strongly that you not be one either. So what can you do to strengthen your back? You can either work on it muscularly, and that's just fine, but there are things that you can do to tighten up the tissue. And what I suggest, if you're over the age of 30, and you probably are, is to be taking something called strontium citrate. Now, strontium actually hardens the bone. So when you have fractures, when you have osteoporosis, osteopenia, strontium should be the hallmark of how you treat these. You do that, you're going to do fine. The other thing you can do for pain relief, and it's nice to be able to sleep through the night. It's even nicer not to have any discomfort. What do I use? I use something called bromelain. Now, bromelain is a proteolytic enzyme. What does that mean? It means you take it orally, it'll chew up any food in your stomach. But if your stomach is empty, your body will reabsorb it. It floats around in the blood, and it eats up blood clots. It eats up areas of inflammation, and it opens up small blood vessels, like these small arterioles. So individuals that have microvascular ischemia due to, let's say, cryoglobulin or some of these other things, bromelain opens that stuff up. Backache, it is wonderful. What I did for mine was I set my alarm for 4 o'clock in the morning. The second alarm was set for 6. So I'd wake up, the alarm went off, I would take 2 bromelain capsules, a glass of water, go back to sleep. I would wake up pain-free. That, George, is the way to do this. And what does this stuff cost? In my office, it's like $15 for a month. It is not a lot of money for a lot of aggravation avoided.